Hey, Medics, and anyone who's ever wondered why the ambulance will drive past one hospital in favor of another. Let's talk about trauma centers because not all emergency rooms are created equal. So, a trauma center is an emergency room that is specifically equipped to handle serious trauma, like penetrating traumas, falls from great height, major car wrecks, and crush injuries. And there are four different levels of trauma center, and they are important. First, we have the level one trauma center, and this is the top that has everything. They have a 24/7, 365 trauma surgeon and their team. Plus, there's always an operating room that they can go to immediately, a blood bank, an ICU. This is a teaching hospital, so it's connected to some kind of medical school. They do research here, and these hospitals take the most critical cases. So we can take every kind of trauma here because they can absolutely handle it. Now, the level two trauma center is a little bit different. It has a trauma surgeon and their team available 24/7. Available is important. It means that they might just be on call and not at the hospital, which means that it takes time for them and their team to drive to the hospital to be available for surgeries. Also, they don't have to do research and they might not have the same subspecialties like a plastic surgeon, things like that on call or at the hospital at any point in time. But they still handle pretty critical cases. A level three trauma center, we see this more outliers. So, level ones, level twos, we see them in big cities for sure. And then the further out you get from the city, we start seeing level threes. Level threes can stabilize a patient and they can manage them until they get transferred to a higher level of care if that's what that person needs. But things like broken bones, things like that, like they can absolutely take care of. But if it requires surgery, it might have to go out because that service is not necessarily available there at all points in time. And the last we see is a level four trauma center. These are in the very, very rural areas. Your small little local hospital might be at level four if it has any trauma designation at all. They don't have to. So these places, they don't have surgeons, right? They will initially stabilize that patient and then ship them out. Whether or not they have to call an ambulance service to do that or they have to call a helicopter to do that, they will stabilize them and then transfer them to a higher level of care. But it means that these very rural areas still have some kind of trauma care because Lord knows I've worked some pretty terrible traumas in rural areas. So it's important that the services of some sort are still available, but they just don't have the resources to take these very high critical cases and manage them in house. So if we're transporting someone with serious traumatic injuries, we're looking for a level two or higher. Why? Well, time matters, but so does the right team. And driving a little further to get you to the right team for your injuries is going to make a huge impact on your health. These smaller hospitals might not be able to stop internal bleeding or take you to emergency surgery, but these bigger hospitals will. And if I can get you there quicker without having to delay you at another hospital and wait for a transfer, you can have the best outcome. We, as your local paramedics, have to learn all of the trauma designations of the hospitals that we transport to. So please, if they make a suggestion like, hey, we should probably go here, please listen and let us take you because we'd love to take care of you. And that's all I have for your Medical Monday.